Kamala Harris has flip-flopped on Medicare for All so many times, it's impossible to keep count. Well, she's just released what people are calling her version of a Medicare for All plan, which, let's be real, it's a glorified public option. That's all Kamala Harris' plan is. It's factually incorrect to call this a Medicare for All proposal. One of the most annoying things of this primary season has been how corporate Democrats have co-opted the phrase Medicare for All and using it in the names of their centrist proposals. Medicare for All has a very specific meaning. Medicare is the government program that covers all primary health costs for seniors, with the exception of dental and some other things, with no out-of-pocket expenses. When people say Medicare for All, it means at the very least, you're going to provide the government-run single-payer Medicare program to everyone in the country, and progressives like Bernie Sanders argue that we should expand the basics of what Medicare covers to include dental and vision and all that stuff. Hence, Medicare for All. It's not a gimmick. That's not some random name that sounds good but has a vague meaning open to interpretation like the Affordable Care Act. Medicare for All has an explicit, literal meaning, expanding the Medicare program to all Americans, full stop. So when anyone, including Kamala Harris, comes out with a healthcare proposal that allows primary healthcare to be paid for by private health insurance companies, but also gives people the option to enroll in a government-run health insurance system, by definition, that's a public option. And to call it anything else is disingenuous and misleading. So all this Medicare plus, Medicare for America, Kamala Harris just flat out calls her plan Medicare for All. Doing is trying to ride off the popularity of Medicare for All by putting it in the title. But when you look at the policy, it's a bait and switch, and at best, it's a public option. Now, there are some good provisions in her proposal, and if I'm being honest, short of Medicare for All, this would be the most radical change to our healthcare system that anyone has ever proposed. That being said, it's not Medicare for All. Before I give you some of the bullet points of her proposal, I want to preface it by saying I don't believe her. She's proven herself to be inconsistent on the issue of healthcare for the entire campaign. She's for Medicare for All. She's not for Medicare for All. She wants to eliminate private health insurance companies. Now she has private health insurance companies as part of her proposal. For someone to be all over the place on the one issue of healthcare alone in just 7 months, it shows that she doesn't have any core beliefs on this issue, and she's willing to go with whatever is politically convenient for her at the moment. Like Elizabeth Warren, she's inconsistent. She's not sincere. Anything she's saying on the campaign trail at this point is just rhetoric, and I'll believe it when I see it. That being said, I'm going to give you the bullet points of this proposal, and then I'm going to break it down and tell you what I think about it. So it mandates private health insurance companies provide the same benefits as the government-run public option would. Newborns and anyone who is uninsured will automatically be enrolled in the public option, which is actually a really good thing because there are 30 million people without health insurance in the United States. I know a lot of those people who have no health insurance. So to automatically enroll them in the public option would be great. But again, it's not Medicare for All. This is a direct quote from her. Quote, "I'll institute a serious audit of prescription drug costs to ensure pharmaceutical companies are not charging more than other comparable countries." Okay, so she has no concrete plan to lower drug prices. Bernie Sanders has a concrete plan to lower drug prices. What she's saying is, I'll, get a panel and we'll look into these drug prices just to make sure nobody's getting ripped off here. I don't know if anybody is, but just to make sure that's not happening. Like, if you were serious about lowering drug prices in the United States, you just flat out say it, we're going to cut drug prices in half like Bernie Sanders does. Because it's not a question if pharmaceutical companies are ripping people off and exploiting them. It's been proven over and over and over again. Sometimes we paid 10 times more for the same drug that you would pay for in another country. And a lot of times they made by the same company in the same factories in the United States. So what other way can you interpret that other than pharmaceutical companies exploiting Americans and ripping off sick Americans? That's what it is. So when she talks about, quote, I'll institute a serious audit of prescription drug costs to ensure pharmaceutical companies aren't charging more than other comparable countries. That's what that sounds like, is when somebody asks Trump something that he knows absolutely nothing about, or that he has no intention of doing anything about, he says, we'll look into it strongly. Like, what the fuck does that mean? That doesn't mean anything. That's like, I'm going to talking about this issue. And then once we talking about this issue, we'll talk about the possible solutions that we could implement to fix this possible problem that we may or may not have. We have to talk about this issue first to see if we even have a problem. And then after that, we'll talk about the steps we're going to take to implement the solution to the problem that we may not have, that we'll figure out after we talk about this issue. Like, it's just a whole lot of talking and not saying anything. If you want to lower prescription drug prices in the United States, you just say it, I'm going to lower prescription drug prices, which leads me to believe that she won't do it. And then there's a 10-year transition for this plan to come into full effect. 10 years to completely have a public option, not even Medicare for all. Before I take this proposal from Kamala Harris apart, I will give her credit on this. There's a part where she one-ups Bernie Sanders' Medicare for all plan. She says she won't raise taxes on anyone making less than $100,000 a year. Instead, she wants to pay for her proposal with tax increases on anyone making at least $100,000 a year, as well as taxes on Wall Street trading. Now, Kamala Harris may be able to do this because her plan doesn't have everyone in the country included in a single payer program. Instead, you have a much smaller public option pool to pay for, and then the rest of the country is covered by the private health insurance companies. But even though Bernie Sanders' tax increases aren't unreasonable, since they are only 4% of your income, and it starts at households making over $30,000 a year, which is the top 50% of earners in the United States. And then it completely eliminates any deductibles and copays that you'd have, or rising premiums from the private health insurance companies. I would like to know what Bernie thinks about paying for his Medicare for All plan with that transaction tax on Wall Street trading, and tax increases on corporations, and increasing taxes on anyone making more than $100,000 a year. I think that's an interesting conversation to have on the left. But back to Kamala Harris's public option. Now, my guess is these two adjacent programs, the private health insurance system and the public option, are not going to be exactly the same. In fact, it's implied right there in Kamala Harris' proposal. She gives the option to buy into the public option system. If these, quote, Medicare plans provided by the private health insurance companies is exactly the same as a public option, why would anybody do a lump sum payment to get into the public option? So right off the bat, she acknowledges that the private health insurance system is still going to be worse than the government-run public option, regardless of whatever regulation she wants to propose. And while we're on the topic of buying into the public option, she never mentions how much it will cost to buy into the public option. 75% of this country is living paycheck to paycheck. How much you charge people to join this government-run public option will be a deciding factor in whether or not they get the healthcare that they need. Another thing, about 50% of the country is covered by private insurance provided by their employer. Kamala Harris' healthcare plan mentions nothing about eliminating the networks of healthcare providers that are covered by specific insurance plans. So the way things are right now, a person's insurance is only valid if you go to healthcare providers in the approved network. Under Kamala Harris' proposal, you have a, quote, Medicare plan provided by insurance companies. But if for whatever reason you need to go to a doctor outside of your network, you're paying for it out of pocket. Kamala Harris also mentions nothing about overhead costs. The overhead costs for her public option, if it keeps in line with the overhead costs and administrative costs of Medicare right now, it's going to be about 2%. But right now, the overhead cost for private health insurance companies is about 20%. So if everything were to remain equal under Kamala Harris' plan, the private health insurance system in administrative cost will be 10 times higher than under the public option system. So billions of dollars that could be going to healthcare would instead be going into the pockets of executives at these private health insurance companies. So those are just some examples I came up with just off the top of my head that shows Even though Kamala Harris is trying to act like there would be no difference between someone signing up for the public option and someone having a plan with similar benefits provided by the private health insurance company, there will be a difference. Once we acknowledge that there's going to be a difference in the quality of these plans and even in the cost of these plans, it raises a bunch of other concerns. You've been going around talking about healthcare as a right. If healthcare is a right, why is it under your proposal, if I need to go to a doctor outside of my network and I have one of these so-called Medicare plans from a private health insurance companies, I have to pay out of pocket? When you put it like that, healthcare doesn't sound like a right guaranteed to every citizen. It sounds like a private commodity that if you have the money for it, you get it. And if you don't have the money for it, you don't get it. You say you want to cover everyone at the lowest possible cost. If that's the case, like I mentioned earlier, the public option is clearly going to be cheaper than the private health insurance system off of overhead administrative costs alone. So if you were being consistent, wouldn't it make more sense to have everyone covered under the government health insurance program? Because it would cost less, and you said that's one of your main goals. She's acting like she's doing a gigantic favor to the American people by giving them this, quote, choice. In reality, what she's doing above everything else that she claims is her priority when it comes to healthcare policy is protecting the profits of the private health insurance industry. That seems to be her top priority. Or else, why would you force 50% of the country to stay in the private health insurance system that is going to cost more and cover less than the public option plan? Regardless of all her rhetoric about how vicious the private health insurance industry is, Kamala Harris still thinks that healthcare is something that private industry should be making a profit on, or else we wouldn't even be having this discussion about a public option and private insurance companies providing Medicare benefits. Progressives and the base of the Democratic Party have a radically different view of healthcare. One quick point I want to make about this 10-year transition in her plan. That is way too much time. She's giving the Republicans and corporate Democrats and the private health insurance industry, who they both serve, ample time to come up with a way to stop this proposal before it's fully implemented. And at that point, we'd be left with a half-assed half measure. Under her best case scenario, if she gets 2 terms, she still won't be able to fully oversee the implementation. She'd be relying on the next president being a Democrat, and also a Democrat who's not to her right. All it takes is the next president to come in and say, yeah, I'm not really feeling this whole public option thing, and stop halfway through, and we're back to square one without even a fully implemented public option. Now, regardless if she actually believes what she put in this proposal, there's no way she's getting this passed through Congress. That is a flat fact. She'd have to get Nancy Pelosi and Chuck Schumer and all the other corporate Democrats who are heavily funded by the private health insurance industry to essentially gut the profits of some of their top donors to the Democratic Party. This plan would cost the insurance industry trillions of dollars. Corporate Democrats, for their entire careers, have been doing what's in the best interest of the private health insurance industry. A mealy-mouthed, wishy-washy, non-committal Kamala Harris coming into the White House is not going to change that. In fact, she'll end up taking money in the general election from the same exact people and arguably be just as beholden to the insurance industry as the rest of the corporate Democrats. And I haven't even mentioned the opposition that she's going to face from Republicans. So just know, any Kamala Harris healthcare policy that comes to Congress will be watered down and ridden with compromise and concessions to the private health insurance industry. Bernie Sanders, on the other hand, has made very clear how he's going to get Medicare for all passed. Let me lay this out for you. If Bernie Sanders is a Democratic nominee, that means progressive candidates like Justice Democrats and Our Revolution candidates who he will campaign with will most likely win their primaries too. That means an unprecedented wave of progressives running on Bernie Sanders' healthcare proposal will be in Congress. That already answers one big part of the equation. Now, if the numbers aren't as overwhelming as I'd like them to be, and we don't have an actual progressive Speaker of the House and majority leader in the Senate, Bernie's already committed to going to the districts of congressional leadership and applying an unprecedented amount of grassroots pressure to either force them into supporting Medicare for all or making them lose their seats. Bernie Sanders has a grassroots army across the country, and they are coming with pitchforks and torches. I believe if Bernie Sanders doesn't have the numbers to pass the Medicare for all on day one, he damn sure is going to have it by the end of his first term. So when Kamala Harris and all the other centrists propose their healthcare plans, you need to factor in that they won't have the mandate or the will to get that policy through like Bernie Sanders will. As radical and left-wing as Kamala Harris's proposal sounds right now, it would never, ever get through Congress. It would look a lot different and it would be a lot more watered down. So this Kamala Harris plan, basically a knockoff version of Bernie Sanders' Medicare for All. Even though it's already to the right of Medicare for All, don't be surprised if she makes even more concessions to the private health insurance industry.